Hi, Dr. Andrew Young over at St. John's. Welcome back. This is now the second of several classes. We're just breaking our joint replacement class down into several sections. So now this is the second. Please refer to the first one to go over anatomy, education, and information about our hospital. Okay, this one is going to be a little bit more in the weeds where we talk very specifically about how to prepare for surgery. Things like medications, what to bring, and home health services. Okay, so remember, so since this is recorded, you're welcome to pause it at any time. There's often a lot of information on the slide. Go ahead, pause, write everything down. You can rewind. Secondly, this is a recorded version of Tracy's class. Tracy does this live. She does a far better job than I do. She's our nurse instructor. She does this all the time. This is just for people who are unable to attend the class. So reach out, take advantage of that resource. Tracy is wonderful. All right, let's get started. We're just going to go over two things, preparing for surgery and just the logistics of preparing your home for surgery. We'll start with preparing for surgery. Okay, we'll go over several topics. First, we'll start preparing for surgery as it relates to medications, which ones to stop and which ones you can continue. Our program of infection prevention, specifically what you need to do to prepare for surgery to minimize the risk of infection, how we manage dental work, and some helpful tips on optimizing your health and eating and drinking. Okay, there is a lot of information on this slide, so before we even begin, feel free to pause and copy this stuff down. Okay. There are two types of medicines that we want you to stop prior to surgery, and these are all related to blood thinners. Now, the first one are the anti-inflammatories. These are the things that you can get either by prescription or over the counter. They're very common. So many people have arthritis take these: ibuprofen, Advil, Aleve, list goes on. These are anti-inflammatories, but they also have an effect on blood coagulation. They make people bleed a little bit more. So if possible, we would like our patients to stop these medications 7 days prior to surgery to reduce the risk of bleeding. There's one exception, that's aspirin. Aspirin is often recommended by the cardiologist or the internist as part of heart health. Sometimes these doctors will ask you to continue aspirin, and we will agree with that. So for most of the over-counters, I know they help, but we need you to stop 7 days prior to surgery to decrease your risk of bleeding. Aspirin will often be recommended that you continue, so go ahead with that. The second major class of medications to stop prior to surgery are the blood thinners. If you're not on a blood thinner, don't worry about this. Those of you who are on blood thinners know you're on blood thinners. These involve aspirin, Plavix, Coumadin, Eliquis, Xarelto, Agrinox. You see the list. These medicines are much stronger than the anti-inflammatories. They cause the blood to be very thin. We ask these medications to stop anywhere between 3 to 7 days ahead of time. It varies on the type of medication, and it varies as it relates to the indication for the medication. So the cardiologist or the internist will tell you how many days in advance to stop. We also recommend that patients stop birth control pills prior to surgery. Now, on the day of surgery, we expect you to take all your routine medications, high blood pressure, cholesterol, etc. However, diabetic medications are different. If you are on insulin, take half your dose. So remember, take all your medications. But for diabetes, we're different. If you are on insulin, take half your dose. If you are on an oral pill for diabetes, that's an oral hypoglycemic, do not take that pill. Okay? So don't take it the morning of surgery. The instructions are here. All your other medications you can take up until the day of surgery, especially things like Tylenol, gabapentin, your regular medications. There are two very important steps patients need to follow to decrease the risk of infection. One is showering with Hibiclens, the other one is mupirocin ointment. The Hibiclens is relatively straightforward. You pick up a 4-ounce bottle prior to surgery. You take 2 showers, one the night before surgery and one on the morning of surgery. It's very straightforward. You take a regular shower. Afterwards, use half the bottle, apply it to your non-sensitive areas, leave it on for a minute, and then rinse it off. That's it. You take one night before surgery, you take one on the morning of surgery. These 2 showers substantially decrease your risk of infection. The second important tactic is mupirocin ointment, also known as Bactroban. there's a lot of bacteria living in the nose. So what we need you to do is, starting 5 days prior to surgery, you apply a little drop of this to each of the nostrils in the morning and in the evening until the day of surgery. So it's relatively straightforward. A little bit here, a little bit here. Pinch your nose, rub it around. That's about it. In terms of housekeeping, try to get all your routine dental work, things like teeth cleaning or whatever dental work done, completed a week before your surgery date. And then after surgery, all non-emergent dental work should be scheduled 3 months afterwards. If there's an emergency, of course you can go in, but if it's non-emergent routine, try to wait 3 months after your joint replacement. Also, before you come to the hospital, please remove all your piercings and jewelry. As you prepare for surgery, you want to optimize your physical health. Part of that is just stopping bad habits. Decrease your smoking, decrease your alcohol intake. These substantially improve your health as you prepare yourself for surgery. Stay active. And very importantly, prepare yourself nutritionally. Protein is the building block for wound healing and tissue repair. Have a balanced diet. Have something rich in protein prior to surgery. Now, this next slide has to do with eating and drinking the day before surgery. So very importantly, do not eat or drink anything after midnight the night before surgery. We want to protect you. Eating or drinking causes acid to build up in the stomach. And if you have acid in your stomach and you're having surgery and you gag, there's a chance that the acid can go into your lungs. That's awful. We do not want you to aspirate. So do not eat or drink anything the night before surgery. However, we also don't want you to be dehydrated. So we want you to drink 2 full glasses of water. That's it, just water, before you leave home to come to the hospital. Do not drink anything other than water. We do not want acid stimulated in your stomach. Just drink water so you're not dehydrated. Just a couple of reminders. Also, we want you to prepare your home for your return before you leave for the hospital. This just makes your recovery much less stressful. We'll go over the care coach and what to bring in home health services. Preparing your home is mostly so that you're as safe as possible, minimizing the risk of an injury, and just making life as easy as possible. So on your home, please pick up your throw rugs or anything you can trip on. Prepare your food, stock your kitchen with healthy meals, and especially remove clutter. Make sure your cane or walker doesn't trip as you're moving around the house. Don't forget about pets. Make arrangements, especially for walking. There are a lot of walking services or neighbors. Reach out to them prior to surgery so they're cared for. And fill routine medications in advance if possible. High blood pressure, thyroid, cholesterol. Just make sure you have enough of this prior to your surgery. It will make your recovery much less stressful. It's also a very good idea to designate or identify a care coach. And a care coach is a fancy word for a family member, a friend, or neighbor, somebody who's just going to look out for you as you go through recovery. It's somebody who can be with you at the hospital to help you with exercise or therapy or prescriptions, somebody who can drive you to the hospital and from the hospital and the follow-up appointments, just somebody there to be an extra set of eyes and ears and hands to help you. And for many people, it can be uncomfortable. Many people do not have family or friends as they look towards surgery. But it's okay to ask. We've seen this thousands of times, how willing people are to help if you just have the courage to ask for some help. Now, as you come to the hospital, as you prepare your bags, you really don't need to bring very much. We have everything here. Basics are picture ID, contact information, medical insurance cards, a credit card for co-pays, a list of medications that you're currently taking. But do not bring the medications from home unless otherwise instructed. So bring the list of medications or supplements. That way it's very easy for us to do the reconciliation, but do not bring the medications. And then this last point, an advanced healthcare directive, which is a living will. Many people don't have it, but remember, surgery is a life event just like all major life events. It's a good idea, even if you don't have this, to at least start having the discussion with your family or friends so they always know what your wishes are should anything happen. We recommend bringing some loose-fitting clothes, just some sweats, comfortable shoes, just personal items. It's a good idea to bring your cell phone and a charger, your toiletries. Now, for people who have a history of sleep apnea, your CPAP or your BiPAP machine, if you plan to stay overnight. Do not bring these items. You don't need to bring in canes or walkers. We'll give you everything, and then don't bring anything valuable. Okay. Home health services refer to outpatient nursing and physical therapy. These are optional. However, we will assume that you will want to use these services. We will pre-arrange these services for you. These include physical therapy and nursing visits. However, you are always welcome to opt out if you feel that these are unnecessary for you. Thank you for attending this virtual education class, part 2. Again, we do have the live back and forth question and answer session run by Tracy. Tracy is our nurse educator. She does a fantastic job. Feel free to watch this again, or feel free to attend that section if you're having surgery at St. John's. And then look out for part 3 coming shortly.